Hello beautiful people, good afternoon from South Africa. You welcome back to my channel. My name is Olivia. In case you're just seeing my face for the first time, thank you, welcome, I appreciate you. Yes, I make content around South Africa, I make content around Nigeria, I make any interesting and important things, so please feel free to hit on the subscribe button, and when you hit on the bell sign, that's where you'll be notified whenever I post a video. Okay, to all my returning amazing subscribers, wow, you guys are the bomb. I appreciate each and every one of you. Thank you for always stopping by. Yes, in case you don't know, I am a Nigerian who lives here in South Africa with my family, and I've been living in South Africa for close to 10 years. Yes, so in today's video is going to be a comparison video, if you can say so, or telling you about Nigerian healthcare system or South African healthcare system. So I'm just going to title this video Nigerian healthcare system or hospital system versus South Africa healthcare or hospital system. You may as well call this video being a patient in Nigeria versus being a patient in South Africa. The feeling you get, what you see. Okay, I always bring things that pertain to South Africa and Nigeria. In case you're in South Africa, you get to know things about Nigeria. In case you're Nigerian, you get to know things about South Africa, or anywhere you are in the world, you get to know things about these two countries, even other African countries I may extend, but for now I'm just talking about South Africa and Nigeria. Hence I have relationships with both countries. Okay, so let's jump right into the video. As always, I do not intend to talk down on any country, not my country Nigeria, not South Africa where I reside, you know. So I love both countries, but I'm just bringing information to you. And again, about Nigeria, I just want to also say again that Nigeria doesn't have a system that comes across board. A few of the things I may talk about may not come across board like to everybody. Nigeria is a country where if you're rich, you are more privileged, way more privileged than if you're an average Nigerian or if you're poor. Okay, unlike South Africa that has a system that comes across board, at least to a reasonable extent, you know, whatever A gets, B can also get it, depending. So yeah, talking about healthcare system in Nigeria, if you're very rich, like super rich politicians and all that, you may have the kind of hospitals you can go to, which is probably an international hospital that was built by international people, you know, and they have a standard that works there, fine. You may be able to go to such hospitals. But if you are an average Nigerian, most of the things apply that I want to talk about. Okay, so yes, so the first thing I want to talk about is consultation in Nigeria. Okay, how we consult when somebody is sick in Nigeria. So if you're sick in Nigeria, the first thing you do is not to go to the hospital. The normal thing you do if you're sick in Nigeria is go to the pharmacy to get a drug. And what we call those pharmacies are chemists. You go to the chemist person will give you medications. So some of the chemist people are not even qualified. I have to say so, honestly. Some of them are just quacks, people that do not even have the license to dispense medication. Yeah, they dispense it for us. That's what we do. It's only when it's very serious that you can you see that this thing is getting out of hands, and you can now start going to the hospital. That is the norm. If you're in Nigeria, please tell me on the comment section if I am lying or if I'm saying the truth. Whereas here in South Africa, if you're sick, if it's not something you can go over the counter to get a medication in the drugstore like this game or clicks, you have to first of all go to the clinic. Depending on what you want to do, you can go to the clinic first, or you go to your GP first. Okay, the general practitioners, you know, private doctors, you can go to them first. That is what you do here in South Africa. When you go to the clinic first, they will take it up from there. Okay, so I just want to make a quick disclaimer. When I'm talking about Nigerian healthcare system, I'm not talking about Nigerian trained medical doctors. Okay, because I know that Nigerian trained medical doctors are well trained and they got the required training, you know, as doctors, and they are real professionals. So I'm not talking about the doctors themselves, I'm talking about the system, the practicing system in Nigeria. Okay, so the doctors in Nigeria are trained to do their duties well, just like the doctors in South Africa are trained to do their duties well. But what I'm talking about is the system, how the country works when it comes to healthcare. The second system I want to talk about them is referral system. Okay, in Nigeria, when you're sick and you eventually are very sick and you get to the hospital, the referral system is very slow. It's mainly from from the either private clinic or federal medical clinic to the tertiary clinics, which we call teaching hospitals. But oh my god, before you get referral, before they even diagnose you or refer you, it's war, because of the queue and the system, and everything is slow, and in fact, frustration. And most times the doctors are on strike because they don't pay the doctors. Some of them, they don't get paid as at when due, so they are on strike, and the system is slow. For you to get referral is very slow in Nigeria. Getting referral is supposed to be from the government hospital to the teaching hospital, and sometimes when you even get to the teaching hospital, before you see the consultants, is a war. You may end up going from there, dying. But unlike South Africa, when you get to the clinic first, if it's way more than what the clinic sisters can handle, sometimes it's mainly sisters that are in the clinic, sometimes they have visiting doctors, sometimes they have doctors, depending on how big the clinic is and the location, right? South Africans, please collaborate with me on the comment section. When you get to the clinic, the sister sees that it's bigger than what they can do, they refer you to the hospital. They call the hospital, level 1 hospital doctors immediately. Ambulance will come and take you. You go there, or you go by yourself. If level 1 doctors see that it's more than us, they'll call level 2 hospital. Level 2 hospital will then say, okay, transfer the patient, because I always hear that word, transfer the patient. We'll transfer the patient. After they transfer the patient and they see that maybe it's a big thing, they can't handle it, rarely they can now take you to what do they call it, the tertiary hospitals, which is what we call teaching hospitals. So here in South Africa, the referral system is so fast, bam 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 bam, you get to where you need to be attended to, unlike Nigeria, where you rarely get to the top. It's by the grace of God that you get to the top, except you know somebody that knows somebody that knows somebody in Nigeria. Here in South Africa, you don't need to know anybody that knows anybody. You just need to get yourself to the hospital. Yes, that's the system. The third point I want to talk about, South African medical system versus Nigerian medical system, is how you pay bills in Nigeria and South Africa when you get to the hospital. In South Africa here, people have what you call medical aid. Yes, medical insurance, as you may call it in some countries. Medical insurance helps you pay your bills. If you're a worker, you're a salary earner, most times the organization provides a medical insurance scheme for you, which you'll be paying dependent, they'll be taking it out of your salary, but you have that medical aid. Okay, so in Nigeria, there's nothing like medical aid. In fact, all my life in Nigeria, I never heard of medical aid till I came to South Africa. If you're a Nigerian, or if you were in Nigeria and you heard of medical aid, please tell me, because I didn't hear. My mom was a teacher, she taught with the government till she got retired. She never had any medical aid. Unlike if she was a South African person, she would have had what you call GEMS, Government Employees Medical Scheme. In Nigeria, when you're sick, you're asked to deposit money, pay deposit of 100,000. If you don't have that deposit, the doctors are not going to attend to you. They are not going to attend to you. But if you have it, you can pay the deposits. In South Africa, you just need to present your medical aid card. Yes, and you get treated. They start treating you, they take it up from there. So even the low income earners in South Africa, so long as you're working with an establishment, you have a medical aid, okay, depending on your status. Or alternatively, in South Africa, if you do not work or you're not employed at all, the government hospital is there for you, like level 1 clinic, level 1, level 2, level 3. Hospitals are free. Yes, did you hear me? Free. Yes, you have to pay a stipend, a little thing, but it's generally free. And when I'm telling you generally free, you get the whole attention that you want. It's also as good as the private hospitals. Yes, it's just that it's government, funded and all that. So you walk into the hospital, you get treated free. South Africans, please, if I'm lying, collaborate with me on the comment section. And if you also think I'm saying the truth, tell me on the comment section where I am wrong. I stand corrected, but I know that most things I'm saying is true. And also, if you're a Nigerian, I stand corrected, but I know that most things I'm saying is true. Yes. So that is how payments goes here in South Africa. And that's how payment goes in Nigeria. Only a few opportune individuals in Nigeria have medical aid. From what I heard, bankers and people that work with oil company, they have medical aid, because my sister is a banker and she has her medical insurance. But normal, average Nigerians, civil servants and workers, they do not have medical insurance. Okay. The next point I want to talk about is tests and samples. How tests and samples are handled in Nigeria versus South Africa. What I mean by tests and samples, like blood, when you do a blood work, or maybe you have a lump. Let me give you a story. So when I was in my second year in the university, I had this lump I had to go and remove. Okay, so I went to the hospital so that they can remove the lump for me. They removed the lump for me. Do you know that these people gave me the lump in a solution, and they asked me to transport it myself to the Federal Medical Center where it will be tested. Their histopathology lab. Mad, crazy. You know, when you're living in Nigeria, you think it's a normal thing, but my dear. I took this sample though. I kept it in my room for over 3 months. You know, they preserve it in that what they used to preserve things in the laboratory. It won't spoil. They gave it to me. I left it in my room for 3 months. It's only my mom that was calling me, Chinomso, have you sent the sample to the lab? Have you sent the sample to the lab? I eventually sent it to the lab. The day I got to the lab, I got there and the person that receives it said, oh, sorry, the histopathologist is not around. I said, okay, I'm here to give my sample. She said, bring it. I brought it. I paid money. I left my cell number. Nobody called me for 3 months, 3 good months. I hadn't received any call about my sample. And I called. They said, oh, sorry, the histopathologist is not around. Please call back. 2 weeks later, call back. The histopathologist is not. This histopathologist that they don't see. That is how I said, I beg you, should take this sample. Can you imagine? You know, this is a very serious thing. Unlike if this kind of thing happens in South Africa here. I have another experience where I had to remove a lump also in my neck in South Africa. The doctor, what you and the surgeon will do is immediately you come out from the theater, they will tell you, okay, the sample has been sent to the lab. You don't have any business with samples in South Africa. You do not have business with samples. We'll call you for the results. And when the result actually comes out, they call you. They do not need you to. If the result is bad, they will invite you, okay, come in. We need to talk to you. If the result is okay, they'll call you, oh, sorry, the sample, the result is out and it's just histoma or whatever medical name they call it. Like literally, it's nothing. So the next point I'm going to be talking about is follow-up. You know, when you see a doctor, you need a follow-up. Here in South Africa, if you see a doctor, they will give you follow-up. They will say, okay, come in the next 2 days, come in the next 1 week, come in the next two months, so that we will follow the case up and know if you're recuperating or whatever your situation is. But in Nigeria, doctors will not give you follow-up. In fact, even if they give you follow-up, if you go, they might not be there in the hospital. And if you, oh my God, most times also, patients will not go for their own follow-up because you know you're paying. The more follow-up you're going, the more you're paying money. So you will not even go. So follow-up system is zero in Nigeria, unlike South Africa here. Like I recently had a problem in my ear. I had to see this ENT, just a boil. I had to see this ENT doctor for like 4 times before he finally wrote me a note and said, okay, you're discharged. They'll stop using things on your ear. Don't put cotton bud, all those kind of things. They give you follow-up, unlike Nigeria. The next point I'm talking about is emergency services, Nigeria and South Africa. Oh my God. Emergency services like ambulance and all that. If something happens in Nigeria and people are in a road accident, unfortunately, if there are no good Samaritans to take you to the hospital, that person is dying, you're dying, okay? The ambulance system in Nigeria doesn't work. I don't think I've ever seen an ambulance in Nigeria, honestly. Please, if you have seen, tell me on the comment section. Yes, there are ambulances in Nigeria, but I'm sure they'll be in big cities like Abuja, Lagos, Port Harcourt, all those kind of things, and there are very few. Yes, I'm saying it's very few. But here in South Africa, even if you're in the rural area and something happens, oh my God, in the next, say, 10 minutes, you will see different ambulance running. one were going to the scene to go and rescue, you know, the victims. There was a time my husband was in an accident, and it was even the ambulance people that gave me a call and say your husband is in so and so hospital, come. You can imagine. If it was in Nigeria, such kind of things will not happen. You won't even know what will happen. Like, it's crazy. It's crazy. Also, emergency, of course. And in South Africa, and if ambulance takes you to the hospital, you're going straight to the emergency unit, and you see the doctors running helter-skelter, you know, just like American film. Running helter-skelter, bring the blood, bring the speculum, bring this one, bring this one. But in Nigeria, it's a story for another day. It doesn't happen like that, though. We don't have emergency units. We will have, but it's not readily available. These things I'm telling you, they are there in Nigeria, but there might be Abuja, Lagos, in some kind of high-tech areas. That is where you see those things. And what if you're not in those places? You're just in normal Nigeria. You won't have access to those kind of services. The last point I'm going to be discussing is medical services in South Africa and Nigeria in terms of maybe blood, drugs, and drips. If something happens to you in Nigeria, they'll call your relatives, come and donate blood, or come and donate blood. If you don't have relatives that have your blood type, you're a goner. Sorry is your name. And if something happens to you, you're in the hospital, they'll call your relatives. Oh yeah, Oga, come and go and buy this drug for your wife, or if not, she'll die here. You know, your relatives will go and be buying drugs, drip outside to bring to the hospital so that they will treat you. Oh my God. Unlike here in South Africa, if you need blood, there's blood bank in the hospitals. There are readily available blood banks. If you need drips, all the equipment, like hospitals have well-equipped pharmacies that any medication they need, like they'll get it from the pharmacy and use to treat you. That is the difference between South African medical system and Nigerian medical system. That's my experience, or that is an experience of an average patient in Nigeria or South Africa. Yes, please, this video is to tell Nigerian government, you people are not trying, You people are not trying. You people, any of you that comes across this video, do something, okay? Thank you so much. Please tell me on the comment section if any of the points I made rings a bell to you, either wherever you're from, Nigeria, South Africa, wherever you are, whichever country you are. And if you're not yet subscribed to this channel, please hit on the subscribe button and make sure you thumbs up on this video. It helps this video, okay? It helps people to see this video and share. You people should share so that Nigerians share, okay? Please share this video, like, comment, and I'll see you in my next one. Bye.